One local doctor experienced so much death in one night among his COVID-19 patients that he decided to take it to Twitter. What he didn't expect, the overwhelming feedback on his tweet. Our Justina Cornell spoke to Dr. Stephen Brown from Mercy Virtual to learn more.
I'm not really big on Twitter.
Dr. Stephen Brown tends to get a few likes on his tweets.
Typically, I'll write something like, oh, my wife made a really nice pie, and I'll get like 8 people like it, and I'm happy. And I just was exhausted that one night.
Except this specific one stopped users from scrolling.
I had like 70,000 likes.
He says, in 40 years, I have not encountered so much death in 12 hours as last night. I imagine this is what a nuclear incident would feel like.
I just saw no end in sight.
The Mercy physician has lost patients before, but this night was of no compare.
I had 4 people die in about 3 hours, but then they just kept coming and coming. And I think at the end of the 12-hour shift, 7, 8, 9 people died. And there were people who, at the end of my shift, I was looking at, and I said, I just don't think they're going to be here when I start my shift the next day.
The urge was to tell others of the tragedy unfolding.
As soon as the bed is empty, it gets cleaned up, the room gets sterilized, and another person fills that room.
At times, he's kept it to himself.
Sometimes I just have a really good cry.
Yet he's encouraged to continue.
I might lose it after work and then get composed and then move on, because this is our time to step up.
About 95% of the COVID patients he's seeing in the ICU are unvaccinated. Dr. Brown wishes they made a different choice, but the care stays the same.
Even though they're filling up the beds and there's a lot of people who are bashing the anti-vaxxers, and they still, when they get sick, they still need care and compassion and understanding.
Justina Cornell, 5 on your side.